So it's been a lot more stressful in terms of the number of patients that we are seeing, the number of people who've been trying to get hospital beds, who've been trying to get admitted across cities, across hospitals in the city. Fortunately, it's not been anywhere close to the visuals that we see in other parts of the country. So we've we've never had oxygen shortages, for example. We've never had a situation, or I haven't heard of a situation, at least, where somebody in the city of Mumbai uh, passed away because they couldn't find a hospital bed, or was in a really bad shape because they couldn't find a hospital bed. So I think we've been a little more fortunate than the rest of the country in that sense. That being said, everyone has been very anxious and very on the edge about the possibility that we might run into a situation like that, given the fact that the numbers were overwhelming, and we weren't necessarily equipped to handle anything a lot bigger than what we've actually seen. Now, compared to last year, the last year we were already stretched out. We rapidly scaled up the number of beds. There were makeshift facilities which were created. There were hotels which were converted into quarantine centers. There were halls which were converted into quarantine centers for mild patients and anyone who was moderate to severe. There were these massive jumbo centers which were created across the city, uh, which was a pretty impressive scale up in a very short time. Now, the thing is, we thought that that was the maximum we needed. We somehow stretched and we somehow survived that. We thought, it wouldn't ever get worse than that. Unfortunately, it has gotten worse than that this year, just in terms of the sheer number of people getting admitted. So we've been stretched. To answer your question, I think we've been stretched a lot in terms of capacity. We've been anxious and nervous that it might reach a point where individuals would really have adverse clinical outcomes because of a lack of bed. But fortunately, we've not seen that happen. So I think, if you look at the patterns, there was a seroprevalence study which was done somewhere last year in July or August, if I remember right, which had looked at the distribution patterns of antibodies in the population in the city of Mumbai. And it was found that about 57% of individuals in slums or settlements had antibodies, while as it was about 16% of individuals in high rises or apartments who had antibodies. Mm-hmm. Now, if you look at the trend this time around in terms of infections, I think a good 80% of infections seem to have happened in apartments and high rises. And that kind of falls in line with the fact that these were the most vulnerable in terms of having background immunity from past infection, in terms of having antibodies, etc. So I think that's one trend which I think most of us have seen, that it's not so much in the slums this time around. It's more in the high rises and apartments, and that shouldn't surprise anyone based on the seroprevalence data. The second pattern, of course, we are seeing is that a lot of younger individuals this time around are infected compared to the last time around. And I think part of that is just demographics, part of that is just epidemiological. So if you look at the median age of the country, the median age of India is 27, which means that 50% of India's population is younger than 27 years of age. So if you have if you have a virus that's going through the population at this magnitude, it comes as no surprise that a significant proportion of individuals who are infected are likely to be young. Now, a lot of individuals will tell you, a lot of doctors will tell you that they've seen a lot of younger people having sicker disease, right? Mm-hmm. Now, I'm not really sure whether that's again, an epiphenomenon. If you have a large denominator of young people getting infected, even a real minuscule proportion of them who get severely infected will convert into something shocking at the level of a hospital. Right. And if you look at just the sheer number of young people who've been infected, if you still do the math on how many of them have been severe enough to be in the ICU or have passed away with the illness, I wouldn't be surprised at all if that fraction is still a very, very tiny number. So yes, it has been younger individuals who are infected for sure. A small proportion of them have reached hospitals. A small proportion of them have not done well. Which is shocking and unfortunate for somebody who's young, but I think it's still a small proportion if you look at the absolute numbers of people who are infected. The other thing that we've noticed a little different in terms of the virus itself is, number one, the transmissibility or the contagiousness of the virus seems far more than the last time around. So this is almost something that is universally agreed upon. The third thing, which we've also noticed in terms of it being different, is that the immune response for some reason seems to be a lot stronger this time. So a lot more individuals tend to we're observing a lot more individuals having prolonged fevers, So the first time round, it would be 2 or 3 days of fever and individuals would settle. But I think this fever lasting for 8, 9, 10 days, just refusing to budge, is something that we are seeing a lot this time around, and making us all nervous. When somebody has fevers which go on to the 8th, 9th day, you are constantly on the edge, wondering whether their oxygen levels are going to drop sometime soon. So that immune phenomenon seems to be a lot stronger this year. Now, again, whether that's a reflection of the fact that younger individuals tend to have a stronger immune response is something that I'm not sure about. But I think most of us agree that it does seem that the virus is causing these prolonged fevers and prolonged illnesses as compared to last year. So I think what we got right possibly was the fact that we had experienced a pretty bad surge last year. So in terms of triaging, in terms of there's a ward room which triages reasonably well in the city. So you don't get a bed unless you kind of really need a bed. So I think most of the individuals on our wards this time around were on oxygen, really needed to be in the hospital. So we didn't have a lot of individuals who were there just because they were anxious and nervous and pulled the right strings. Mm-hmm. I think we were very cautious about who we admitted. I think that's one thing that we did right. The second thing that we did right was possibly because of the scaling up that was already in place from last year. The existing infrastructure to handle this wave was a lot more in place. The existing channels in terms of maybe supply chains, in terms of knowing what needs to be done given a certain circumstance. I think that experience from last year probably helped us a lot this year round. Also, I mean, I could be wrong in this. I don't know about Delhi, but what's happening in smaller towns is possibly that the background health infrastructure is not in place as well. I think Mumbai has a certain level of a background health infrastructure which could be rapidly recruited into COVID work, versus not having that backbone in place, which can then be scaled up. It's very tough. It's not easy at all. I don't have a simple answer to that.
Do you get a weekend off? Do you get any day off?
No, I don't get any day off.
When was the last time you had a day off, say?
I think it's been a long time now. It's been a reasonably long time. I mean, not since a couple of months at least, since this second wave has started. Even prior to that, the fact that you have patients admitted, the fact that you're doing rounds in any case would make us take rounds on most days. So at least the hospital rounds would happen on most days, whether it's COVID, non-COVID, whatever. But now with this added layer of individuals wanting to teleconsult you nonstop, I think it's become very difficult because, and these are usually individuals who are friends of friends, their family, their extended family. So, everyone's reaching out to you in desperation, and there's no way you can say no. It's just not the right thing to say no. But it's tough because a lot of these individuals under ideal circumstances possibly would be in hospitals.
Yeah.
Vaccine shortages are a real problem right now. A lot of individuals, after the Oxford data came out from suggesting that stretching the second dose might be better for some individuals. After that data came, a lot of individuals said, "Oh, let's take it at 8 weeks. Let's take it at 12 weeks." And a lot of them are struggling to find that second dose now. So and that's a bit unfortunate because there's a study from the US with the same vaccine which said that even 4 weeks was good enough. So a lot of these individuals should have possibly taken it when they could, when the lines weren't that long, when the demand wasn't so high. But everyone said that it's not the right time to take it, delay it, and now they're really struggling. And everyone's asking the question that what happens if you don't get it by 3 months? And we really don't know the answer to that question, right? We don't know what happens when you don't get a booster on time.
Yeah.
I mean, hopefully it will still do what it's meant to do. And there are some suggestions that longer the better, but what's the upper limit of that longer is an answer which nobody knows. There are shortages for sure. Even so, prior to the current surge, the fact that it was initially only opened up to healthcare workers, then it was only opened up to individuals who were 60 and above, or if they were 45 and above with comorbidities. During that phase, we did hear occasionally of vaccination centers going empty and, people not turning up for their shots, and, X number of slots being available, but, 50% of that X getting filled up in a day and the rest lying vacant. So even the take up of the vaccine for some reason wasn't as optimal as it should have been. And maybe that reflects some sort of a communications problem, or, vaccine hesitancy for some reason was there. And then, every time reports come of these extremely rare events like these clots happening, or this VIT that's being described, even if it's an extremely rare event, the media plays it to such an extent that everyone takes a step back again. So there have been so many steps back as a result of these kinds of things that I don't think even the individuals who were eligible, I don't think the entire cohort has probably been vaccinated yet. So I think initially, there were issues with two different vaccines being available. Is one superior to the other? Is the other right? There was that back and forth about, we have two choices, which one should we take? And I think we possibly didn't do a great job of saying, okay, whichever one, both are good. Some vaccines better than no vaccine, maybe. I think that was a moment where the initial problems kind of began, where there was this whole controversy around which vaccine. Eventually, all these controversies around these rare side effects also played a role. Now, for example, it's a known fact, right? The current vaccines which are available, at least, for example, the Oxford vaccine has a 70% efficacy in trials, somewhere between 60 to 80%. So it's a known fact that 30% of individuals, or whatever, for every 100 individuals who are infected, there will be 30 individuals with the vaccine who will also get infected. Mm-hmm. It's a known fact, right? Now, I think we needed to be proactive telling people this, that listen, if you hear of stories of individuals getting infected after receiving 2 doses of the vaccine, it's not shocking at all. It's expected. But the question should be, how many of them had severe disease? How many of them ended up in a hospital? How many of them passed away because of the disease? And that number is a really small fraction. But unfortunately, this was not out there. So everyone on social media started saying, oh, my friend had 2 doses and got the disease. So, why are we taking the vaccine to begin with? So I think that's where communication plays a very important role. And, we have a whole database, for example, of healthcare workers now who've received two doses of the vaccine, right? So all the government needs to do is kind of release that database saying, we have so many healthcare workers who've received 2 doses. During the current surge, how many of them actually got infected? What proportion of them ended up in an ICU? What proportion of them died? And just data like that being out there in the public domain for everyone to see would add to so much more confidence, is what I would think.